Our featured speakers today are Milwaukee County Executive David Crowley, Milwaukee Mayor Tom Barrett, Dr. Ben Weston, Associate Professor at the Medical College of Wisconsin and Director of Medical Services for the Milwaukee County Office of Emergency Management, and Ann Christensen, Health Officer and Director of the North Shore Health Department. County Executive Crowley, you're starting us off today.
Well, thank you so much, Sydney. I want to thank everybody for being here. I first want to start off by recognizing the tremendous work of all of our public health officers across all 19 municipalities here within Milwaukee County. Our public health departments and their teams have been working tirelessly to keep our communities safe and stop the spread of COVID-19. From working with our schools and businesses on guidance to following up with individuals who have tested positive for COVID-19 or may have been exposed, they're carrying a heavy load at a great benefit to our communities. I'd also like to thank the county's many frontline workers, including those working our testing sites. As Mayor Barrett will talk about a little later, our testing numbers are higher than ever. We wouldn't be able to test everyone who needs a test if it wasn't for the hard work and dedication of these frontline workers. But words are hollow without action. There are simple things that we can do to show our gratitude for those working so hard to keep us healthy and safe. If a health department contact tracers contact you, answer their questions. If you're told to quarantine or isolate, follow the guidelines and instructions you have been given. If you have a role to play, we all have a role to play in keeping our communities safe, and it's extremely important as it's ever been to wear a mask in public, wash your hands, and maintain physical distancing. So let's collectively show our appreciation for our public health officers and frontline workers by doing what we can to minimize the spread of COVID-19. But in order to minimize the spread, it is important that we test. And we know that access to testing is critical in preventing the spread of COVID-19. And there are a number of testing locations available throughout the county. And so if you want the latest information on testing sites, the hours and locations, please visit testupmke.com. And finally, tomorrow is Veterans Day. And I want to offer my deepest gratitude to those who have served our country and its armed forces. The sacrifice and service demonstrated by our country's veterans for the betterment of this community and country sets an example for each of us to follow. And so tomorrow, I encourage all of Milwaukee County residents to do at least one thing to honor our veterans. Consider hanging your flag, leading your family in a moment of silence, donating to organizations that serve veterans, or simply just saying thank you to our veterans in our community. Our veterans deserve our support and appreciation on every day of the year, but especially tomorrow. And so with that said, I'd like to hand it over to Mayor Barrett and say thank you for all of your leadership as we continue to go through this pandemic.
Thank you very much, Mr. County Executive, and good afternoon, everyone. As we grapple with the COVID-19 pandemic, we also have to remember that this is flu season as well. And it's very, very important to recognize, as I think most people do, that these two diseases are different and they're treated differently. Fortunately, we do have vaccines that are available for the flu. We heard a lot of good news in the last 36 hours about Pfizer and others who may be making great strides forward, hopefully to have a vaccine that can be effective for people who are suffering from COVID-19 or are prone to get COVID-19. But please don't forget that this is flu season right now. And fortunately, Children's Wisconsin, in partnership with Children's Community Health Plan, the Milwaukee Health Department, and Milwaukee Public Schools will be offering free flu vaccines at Milwaukee Public School sites for the remainder of this week. The flu vaccines are available to all. No insurance, no appointment are necessary. You also do not need to have a Milwaukee Public School student to receive a vaccine. The CDC recommends that everyone ages 6 months and up receive a flu shot. And tomorrow, November 11th, at Ann Dorfler's Elementary School on the south side, will be offering vaccines from 10 a.m. to 2 p.m. while the supply lasts. The following day, on Thursday, Zablocki Community School will offer vaccines again from 10 a.m. to 2 p.m. Getting a flu shot and protecting your health are more important than ever this year. Help us keep our hospitals open and available to care for COVID-19 patients by reducing hospitalizations related to the flu. We know that there's a lot more people that are going into the hospital because of COVID-19. We don't want to make matters worse by having people who have the flu using some of those hospital beds. And because there is a vaccine available for the flu, it certainly is in everyone's best interest that everyone gets the flu shot, so that if you are in the unlikely and unfortunate situation where you contract COVID-19 and have to go in the hospital, that the beds will be there, because we know that that is becoming a growing issue throughout the state of Wisconsin. In several minutes, I'll talk a little bit about our community testing sites, but I did see a report that Aurora might be making changes to its testing efforts. And I think it would be a mistake for Aurora to end its community testing. When this began, we started out very, very clearly wanting to have a partnership with county government, with city government, with state government, and with our healthcare providers. And while I recognize that all healthcare providers are being inundated right now with patients, there still, I believe, is a responsibility for all of our healthcare partners to continue to be our partners in testing as well. Ascension remains a partner. Freighter remains a partner. The community clinics remain a partner. And I want to see Aurora remain a partner as well. As you may recall, they had a site on 60th and Capitol, and we actually moved the National Guard site from that site at 60th and Capitol, because we felt that in the long term, having Aurora as our partner was a solution to what we're trying to do. After we moved the National Guard from 60th and Capitol up to Custer High School, we learned months later that Aurora was going to be closing that site for testing, but I was told that that testing would occur at Sinai Samaritan. Now I'm hearing reports that Sinai Samaritan might not be testing. We all have an obligation to be part of this testing efforts. And so I will be talking to representatives from Aurora, but I want to make it clear that I believe that all the hospital systems and all of our federally community health centers should remain partners with us as we try to continue to test. We cannot do it ourselves. And you'll see when I talk about numbers, just the incredible pressure that we're under right now. In fact, if you look yesterday at Miller Park, which we set up for approximately 2,000, maybe a little more than 2,000, we tested 2,805 people at Miller Park on yesterday. On the northwest side, we tested 586 people. On the south side, we tested 528 people. So the city of Milwaukee total for one day with our resources is close to 4,000. And I don't think it's reasonable to expect our resources that are very limited and may be ending December 31st should pick up the slack if we have one of our major partners make a decision that they're not going to be doing this testing. And again, I understand that there's pressures on all of our systems, but keep in mind, Miller Park continues to exceed its designated capacity of 2,000 tests a day, and both the Northwest and Southside health centers are exceeding their design capacity of 400 tests each day. We're all doing more than we can. And we're all doing more than we can because unfortunately, the spike in cases is requiring us to do so. This is not a time to be leaving the partnership. I want to encourage our residents to take advantage of alternatives to our community testing sites. Community health centers and a number of pharmacies are excellent locations. You can find the full map of testing locations at milwaukee.gov/COVID testing. And as we continue to see cases rise and our demand for testing increase, we need our residents to use all our testing sites efficiently and appropriately to avoid long lines and to be sure that everyone receives a test in a timely manner. I do want to also point out that I want to remind everyone that the Northwest and Southside health centers will be closed tomorrow, November 11th, in observance of Veterans Day. Miller Park will remain open for walk-up and drive-through testing from 11 a.m. to 6 p.m. So in honor of veterans, those two sites will not be open, but again, Miller Park will be open tomorrow. Once again, as we oftentimes have done, as COVID-19 cases continue to surge in our state, and I understand the governor may be speaking later today on this issue, it's important as ever, and probably more important than ever, to avoid group activities where COVID-19 exposure is possible. In Milwaukee, we are currently at a 14.7 average % positivity rate, with 3 out of our 5 key indicators now at red and 2 at yellow. We are not, unfortunately, moving in the right direction. This is all, a lot of this, I should say, comes down to personal behavior. Changes in our behavior lessen the spread of the disease, reducing the demand for testing and decrease the testing volume at community sites. So make sure you continue to wear your mask when you're around others, maintain that 6 feet of physical distancing, and continue to wash your hands and commonly use surfaces to stop the spread of the disease. We need to go back to the basics and renew our commitment to fighting COVID-19. And again, and we keep saying this again, but I'm going to say it one more time, stopping the spread is about more than just yourself. It's not about ourselves. It's about protecting our loved ones, our neighbors, and the elderly in our community. I know we're all tired. I'm tired. You're tired. Everybody's tired of this, but we must remain vigilant and do what is necessary to protect our community and help our hospital systems by driving our % positive back down to where it needs to be. And with that, I'll turn it over to Dr. Weston.
Thank you, Mr. Mayor. Good afternoon. First, as always, to our numbers, we've had now over 50,000, 50,915 confirmed cases of COVID-19 in our community, and 529 individuals who've died. The state once again broke the previous record with the largest single-day increase in hospitalizations for COVID-19 patients yesterday, with 143 additional COVID hospitalizations. Unfortunately, Milwaukee County hospitals are on the same trajectory with over 50 new COVID hospitalizations just over the weekend, another record for us. No matter how well positioned our healthcare assets are, no healthcare system and no hospital can keep up with caring for patients on this current worsening trajectory. We're seeing busy hospitals and busy emergency departments. Please remember that emergency departments are for emergencies only. They're not places to seek out routine COVID testing. This is for the health and safety of everyone in our community. We have to keep our EDs for the folks who are sick with COVID. And I can tell you from working in the emergency department just this past weekend, there's no shortage of critically ill COVID patients. We do have, however, many sites, many testing sites now in our county that do allow for routine testing, and we're continuing to expand on testing locations. The Test Up MKE site is kept up to date with testing sites and lists 40 different testing sites in the county, all available regardless of income, insurance, or immigration status. The Miller Park testing site has no shortage of tests, but certainly with the long lines on busy days like yesterday, they do have to cut it off at some point to ensure that the folks working so hard to efficiently and quickly test thousands of people can get a bit of rest and return healthy the next day to continue serving our community. So please visit testupmke.com and consider all of the different 40 testing sites available. We're seeing a troubling combination of increased testing now at record levels, along with a sustained increase in % positivity. You typically suspect that increased testing numbers would drive down the % of people testing positive, but we're seeing the opposite. This is a bad sign. It's a sign of accelerating trends and no slowing of those trends in sight. Election day has passed, but COVID continues unabated and worse than ever. We need to buckle down, we need to be personally responsible, and we need to protect our community. We had good news this week on what appears to be preliminary data of a promising vaccine. It was a reminder that there's a lot of work going on right now in the background to get past this pandemic, and there is an endpoint in the future. This won't go on for years, but it will without a doubt go on for months. This is an unusual year, it's a sad year, but we can get through it and we'll all get through it. Thank you and stay safe, and I'll pass it along to North Shore Health Director Christensen.
Hi, thank you. Glad to be back delivering the public health message. Later in October, the local health departments in Milwaukee County and around the southeastern region of Wisconsin put out a call for action for the community to be partners in the process with us of both contact tracing and doing the due diligence of isolating once you are positive. With the case numbers continuing to go up, our local health departments are really struggling to continue to keep up with the volume of cases. Since the beginning, our role has been to notify and investigate all positive cases of COVID, and then trace and contact all of those people who are close contacts of those who've been determined to be positive with COVID, as a way to stop the spread and break that transmission chain for the next group of people that would otherwise be infected. That's important work, and that's what public health departments have done, as I've stated in past visits with you, that we've been doing for many different types of communicable disease. In the situation that we're in now, our challenge is with our small health departments here in Wisconsin being able to manage and keep up with all of our cases. And so really we're at the point where we're pulling the public in to be partners with us in this process so that we don't continue to do it alone. What that means essentially is that local health departments will continue to identify positive cases and investigate those. That investigation may likely be much shorter and not as thorough as it once was. And if you have not been identified or contacted by the local health department, there are still things that you can proactively do that we would have otherwise advised you to do. And that is to isolate, stay home while you're sick for 10 full days. We'd like you to stay home for that period as the time that the disease can run its course and that you are no longer deemed to be infectious. And then you wait and make sure for 24 hours that you don't have a fever and that your symptoms have resolved or been resolving in that time period. That is critically important, that you stay home for that duration of time. Again, so that you don't go out in the public, that you're not at work and you're not at school, therefore infecting others. The other thing that local health departments really are calling on the community to be involved with is identifying and contacting their close contacts. Again, with the number of people that have been out in gatherings and at events, again, we're just not able to keep up with notifying all of those individuals. There are websites, if you don't want to do it directly, that you can go to enter information about your contacts. The state health department website has this information. But you can proactively contact your individuals that you are aware of and let them know that you are positive with COVID and that they should then stay home and quarantine for 14 days. Again, the reason for that quarantine period is to break that transmission cycle. It allows the disease to incubate in the next person, and then if that person become positive, that person then hasn't otherwise infected more people. So this is what we are asking our community to do. Us local health departments are still continuing to have concern waiting for the simple to protect yourself as well as others. The other thing is we put a lot of emphasis on the individuals, but we know that businesses and places where people are gathering in the public are starting to lax a little bit of those mitigation measures. So those are the things like disinfecting, routine cleaning, limiting the number of people inside of a store, and having employees return to work following exposure. So that we're really now, so that we can once again be in a place where we're confident and comfortable going out in public, and wearing our masks and making sure that we're all doing what we can do individually and collectively to make a difference. Again, thanks for your time. And if you have questions specifically, call your local health department and they can certainly be a resource for you.
Thank you, Director Christensen. Our first question comes from Rich Ravito at Milwaukee Magazine for Mayor Barrett and County Executive Crowley. With the city and county reaching grim milestones in reaching record high levels of homicides, what role do you believe the coronavirus pandemic has played in the spike in violence after 3 years of declining numbers?
Well, I think that when we think about this pandemic, it has taken a toll on many people. When we think about the toll, whether that's emotional, physically, mentally, or economically. And this pandemic is not just affecting our homicide rate, but it's also affecting drug-related deaths. It is affecting homicides as well as motor vehicle accidents. And I think for the past 8 months, so many people have been cooped up and have had to change their lives dramatically. And I think it's really just taking a toll on this whole community. But that lets you know that, we have to lean on one another in order to get over this pandemic and move forward continuously. And so, it is unfortunate what we're seeing here throughout the community, but it's going to take all of us to step up and lean on one another to get over this pandemic.
I would concur with the county executive. I think that the last 9 months have been unbelievably stressful for many people, both from a health perspective, certainly for many individuals from an economic perspective. A lot of people have lost their jobs or had their hours reduced or have had their pay reduced. The living quarters, if you are quarantined and you're with a lot of people in a small space, that can cause problems. And as the county executive said, we've seen increases in opioid use. We've seen heroin overdoses. Those are all very, very real as well. So it has had, I think, a very, very troubling effect on all we're going through right now.
Our next question comes from Patrick Palantonio at Channel 12. For Mayor Barrett, you mentioned that city COVID testing might go away at the end of December. Can you please elaborate as to why and who ultimately decides if testing will continue beyond that date?
Well, as you may recall, the pattern we've had here, and I want to again thank Governor Evers because it was with Governor Evers' partnership with the National Guard as well as the county that we were able to set up the National Guard sites. First at Midtown and UMOS, then at Custer and UMOS. That was going to be a temporary arrangement. That was clear to us from the get-go. And so several months ago, we began working with the governor's office to make a transition. And that transition moved from having these sites staffed by National Guard members to having the sites staffed by City of Milwaukee employees. And so what you saw in the last month or so was that transition. That was when we moved to Miller Park. That's when we opened the Northwest Side Health Center and the South Side Health Center to testing. Most of that funding comes through the CARES Act, through the federal government and through the dollars that we receive. We are now, and my concern is that funding ends at the end of the year. And these are expensive operations. And it's not just the city of Milwaukee. I don't know how any local governments throughout the state of Wisconsin are going to be able to handle this unless there is going to be additional action specifically by Congress. And it's concerning to me because now I'm seeing the reports where congressional leaders are saying, well, they may not have the next round of COVID help until January. I don't know if they mean after the new administration, what the political fights are going to be like there. But obviously, we'll be looking to the state, but keep in mind the CARES Act dollars, the bulk of the CARES Act dollars have to be used in 2020. There's a limited number of dollars that come through the CDBG program that can be carried into 2021. But that's a concern. Do I want us to continue to do it? Of course I can. I do, but we have to have the partnership. That's why I talk about these partnerships being so important. And that's why we really need the federal government to step up and once again help us, not just us, but throughout the nation.
And I would like to just add on what the mayor just said. I mean, our first priority is making sure that there are some funds and resources from the federal government. And that's how we're going to be able to continue to do the testing right now. Just because this money runs out at the end of the year doesn't mean that COVID is just going to go away as well. And so not only do we need, governments to step up, but we need our healthcare systems as well to step up to make sure that we're going to continue this testing past the December 31st deadline.
Thank you. Our next question comes from Madeline Anderson at Fox 6. Mayor Barrett, do you know specifically what Governor Evers may be talking about tonight in his address to Wisconsinites about the COVID-19 pandemic? Will the city support his message, whatever it may be?
Short answer, I don't know what it's going to be, but we have worked closely with Governor Evers. I think he's certainly tried to provide leadership, and I congratulate him and thank him for trying to provide leadership. But you can see the fact that the legislature hasn't met since April, and now our numbers are in the top 3 or 4 in the nation, tells you that what's happening in Wisconsin is certainly not working. A laissez-faire approach to COVID-19 has not been successful.
Thank you. Our next question comes from Sari Lusk at the Milwaukee Business Journal. What have you seen in Milwaukee since starting phase 4.2 in terms of the spread of COVID-19 and compliance with the new rules? Are the new rules having their intended impact? Follow-up to that is, what specifically would lead Milwaukee to take additional enforcement steps, such as higher fines? Have you set or discussed any thresholds that would trigger additional enforcement?
Why don't we have Dr. Weston or Director Christensen talk about what they've seen in terms of the disease spread, and then I can talk a little bit more about the enforcement, and others can chime in as well.
Sure, I'm happy to start. So I think when we look at disease spread, we're seeing not just an upward trajectory, but we're seeing a steepening trajectory, and that's really throughout the state. It's throughout the county. So I think the mayor has said before, nothing's off the table. And I think as we look forward, as we see what's coming and understand a worsening trajectory, hopefully through those personal decisions, those safe decisions, we can slow this down. But it's a very concerning trend we're on. It's concerning for individuals. It's concerning for hospitals. It's concerning for our community.
I think, as I mentioned before, working with the business community and places where people are gathering, it's important that we're continuing to educate those employers about what the practices are in place in terms of limiting numbers of people in their establishments, making sure that they're following other protocols like disinfecting. And critically important is making sure that they keep their employees home who've been exposed. We do have reports anecdotally about people who are returning to work following exposure. So we want to make sure that regardless of the orders and the guidelines in place, that people are aware of what are the best practices and are following those. And then when they're not following those, again, educating and trying to work with them is going to be, really the measures that make a difference, because we are all in this together and needing to collectively agree to do the right things.
And I'd like to say that the new rules have had their intended impact, but as you can see from what you've heard earlier, the cases are rising. And so we are concerned about that. And we have had conversations and we are exploring additional enforcement steps, such as higher fines. We've also have more people that are out there enforcing the current order. As you may recall, initially it was going to be on complaint only, and it was going to be education. We were not going to levy fines right away. We were going to use education as a tool to reach compliance, because our goal has never been to be punitive. It's always had a public health thrust. But now that we're in our 7th, 8th month of this, that we have to take steps. And so we have moved away from simply an educational compliance model. We are adding additional individuals to help our teams at our health department so that they can go out and enforce the current laws. And we're looking at, if it's necessary, which it very well might be necessary for us to have higher fines, because we've heard stories of some businesses baking the fine right into their decision and saying, we'll take the big banquet and we'll pay the higher fine. We're still going to make money on it. And that is not consistent with what we're trying to do from a public health perspective.
Our next question comes from Tim Vetcher at TMJ4. To follow up on a previous question, I'd like to hear from everyone on this call what they'd like to hear from the governor in his address tonight. What steps do you want him and other state leaders to take to curb the spread of COVID-19 in Wisconsin?
Well, this is Crowley. I mean, I hope that the governor is going to talk to, bring in more resources to many local different municipalities that are currently on. You should provide the testing as well as the testing many departments with. But I would also say, being a former legislator, I think the governor should also call a special session to have the state legislators come to the table and provide funds for local municipalities as we think about 2021. So I think it's extremely important that our state legislature steps up and works with the governor to find ways to mitigate this virus and help out many of our small businesses as well as our local municipalities as we continue to, tackle this challenge.
And I think Tim's question tells the story. Part of his question is, what steps do you want him, the governor, and the legislators, what steps do you want him and the other state leaders to take to curb the spread of COVID-19? More than anything, I want them to work together, not to rely on the courts to do this, but to come together as a state government to address this now. As the county executive said, come into a special session. Let's not wait till January or February. The elections are over, except for the fighting, but the elections are over. They're certainly over here at the state level. Let's get to work. We've got a lot of work to do. This is the time to try to come together on a bipartisan basis to get this under control.
From
Our
a
next,
Oh.
go ahead.
Sorry, Sydney, just from a public health side, again, just that the governor and the state legislature are working together, as well as the Department of Health Services and other state level governments to really have a strategic and coordinated plan for both testing and contact tracing, so that as a state, we're all moving in the same direction and not competing with one another for precious resources. That would be critically important.
Are we still on?
I believe we're still on. I think we might have had some technical difficulty with Anne.
Sydney may have dropped off.
There she is.
I am
Looks
back.
like it's about the suburbs mandating orders, and is it being discussed? And what would it take to order restrictions?
Sure. I mean, I think similar to what was said before, nothing is off the table in terms of, what we're looking at for disease transmission as we continue to go up. There are no active discussions at this point for mandating orders. I think at the local health department level in the suburbs, we're looking at orders more specifically if there are outbreaks in specific settings. So applying the tools in very specific context rather than sort of blanket restrictions.
Thank you. My internet dropped out for just a second there. Unfortunately, that means I lost any questions that were in the chat. So media, if you have additional questions that we haven't addressed, please re-enter them in chat. This one is for Ann Christensen. I believe you just addressed this, but this is the Kenosha Health Department is recommending schools in the county go virtual. Will the North Shore be making any similar recommendations?
So I have 7 school districts in the North Shore. Many of them are already virtual through this time period. Those who are not, it's really focusing on school operations and what decisions they're able to make in terms of continuing to operate. So rather than, again, sort of a blanket recommendation, each of the school districts is really working with us closely on, what are the disease cases like in their schools? What are the cases, how are the cases impacting their faculty and their teachers? And looking at things more on a case-by-case basis. I think what I will do in terms of recommending and going back to the same recommendations we've had is we know that this is a time period where we are likely to have family gatherings. And that's really the concern. It's not that school being in session or being out of session. So again, those messages for the public about not having larger gatherings, not having Thanksgiving even with members outside your own household, certainly not traveling. Those are all the recommendations that are going to be able to keep us in a learning model where we have in-person schooling at all. So really back to the public, we want kids to be in school. We want them to be in the classroom setting. And so, taking these measures to maintain school operations is critically important. So we don't have to move to such a recommendation or crisis level with the schools.
Thank you, Director Christensen. Our next question is from Casey Cronus at Fox 6 for Dr. Weston. With Thanksgiving just a couple weeks away, could you talk about what you are suggesting in terms of seeing family members over the holidays and the tough decisions people may have to make?
Sure. So it's a doubt on many people's minds, I think. Recent memory that our celebrations will be different from any in recent memory. I think this has to be our COVID year, a year where we have accommodations that we can stay safe, but also stay connected. So for Thanksgiving, it won't look the same as it did last year. Thanksgiving, other winter holidays during the cold months will not be like 4th of July or like Labor Day. We could gather safely out weather. We could be distanced with masks. I think going into the cold weather, we want to avoid large gatherings, but we also want to avoid small gatherings, small groups of people who live outside of our household. So certainly there'll be virtual Thanksgivings. There'll be small Thanksgivings with those with whom you live, but it will be different. And I think we have to work with that. Our numbers are trending so poorly, we can't afford to have any events push us even further in the wrong direction. But that said, this will be challenging. It'll be especially challenging for people who are already isolated. And I think this ties into the earlier question that the county executive and the mayor addressed. We know of many of the side effects and the long-lasting medical effects of COVID, but the record homicide numbers, the record suicide numbers, the record drug overdose numbers speak to the community effects of this crisis. Our 911 system has seen a near doubling in mental health related calls during the pandemic. And of course, mental health concerns are so closely tied to each of those crises within the single crisis. It's important to remember this and certainly to use government and community resources to try to aid individuals in need, but also for every individual to reach out, especially around the holiday season, and support those around you.
It looks like we have one additional question in chat from Sean Kirkby at Wisconsin Health News for Mayor Barrett. Could you clarify what you mean by reports that Aurora Sinai won't be offering community testing? Were those new reports? Has Aurora provided any info on why they're stopping?
It was something that someone directed my attention to on their website, where it stated that they were pausing drive-through and walk-up community testing at this site. I haven't had that confirmed, and I hope that that's not correct. I hope they haven't paused it, and if they paused it, I hope it's a momentary pause and something that they adapt, make changes to right away, because we need them to continue to be a partner with us in our community testing. But it comes directly from their website.
Thank you, Mayor Barrett, and to all of our guests today. Thanks for your time. That concludes our briefing for today. We'll see you again on Thursday. Thank you.
Thank you all very much.
Thanks, everyone.
All right.
Thanks.